Good evening, everyone. Welcome to a brand new episode of BMC Global Live AL-HILAL Health World, Nothing But the Lifestyle. This is a talk show where all your health queries and concerns are addressed by expert doctors. Urology is a vital part of medical care that deals with the diseases of the urinary tract of men and women and kids alike. Today's topic of discussion is BPH, and we have with us Dr. Sankar N., the specialist urologist from AL-HILAL Hospital, Manama. Dr. Sankar has over 12 years of experience in urology, and his area of expertise is andrology, open urological procedures, and endourology. Welcome to the show, doctor.
Thank you.
Could you please explain to us what exactly is BPH?
BPH is a condition that is enlargement of the prostate due to the increase in the number of the cells of the prostate epithelium and matrix. It is the commonly seen in aging men, that is after 50 years of age, and it is in aging men it is one of the most common causes of LUTS, lower urinary tract symptoms. As the name suggests, it is benign prostatic hyperplasia. It is not a cancerous enlargement of the prostate gland.
So it's benign, which means it's not malignant.
It's not malignant.
And how does this disease develop? Like in medical terms, if you put it, it is etiopathogenesis. If you could please explain to us in details what it means.
Etiopathogenesis of the BPH is mainly dependent on the androgens. Everybody thought it is due to testosterone, but the androgen signaling pathway intact should be there for the this development of this condition. Not the testosterone directly causes, but the intact androgen signaling pathway is essential. Androgen signaling pathway means it starts from the brain to the prostate. I will tell this. In the brain hypothalamus, it will produce GnRH, gonadotropin releasing hormones. Anterior pituitary produces luteinizing hormones, LHRH. This LHRH acts on the Leydig cells of the testes to produce testosterone. This testosterone is converted into dihydrotestosterone with the action of 5-alpha reductase in the prostate. Then this dihydrotestosterone is responsible for this BPH condition. So this pathway intactness is essential for this development of this condition.
What are the symptoms normally seen in patients with this disease?
The symptoms are named as LUTS in the abbreviation form, lower urinary tract symptoms. Again LUTS again divided into storage LUTs and voiding LUTs. Storage LUTs means because of the urinary storage it will cause the symptoms. Example, frequency, urgency, nocturia. Whereas voiding LUTs due to the obstruction of the urine flow, mainly straining on the urination and intermittency, incomplete voiding sensation of the bladder.
So basically these are the symptoms that you see in patients when they come with this problem. So what aspects do you keep in mind when you evaluate a patient? What are the things that you look out for?
Actually, when the patient comes, we should directly not jump into the conclusion of BPH. We should ask the detailed history and other medical comorbid conditions, because this symptom will not directly relate to BPH, other neurological diseases, and during treatment any other comorbid conditions like hypertension, cardiac, any history you should ask. Then after history, examination of the patient to look for the bladder palpable or not on supine position, and then genitalia to look for the external urethral opening, meatus, and then per rectal digital examination of the prostate, whether it is any changes of the prostate size and over that consistency of the prostate and mucosa of the rectum. It should be freely mobile over that, or any, if it is hardness, then the cancer chance, other condition will be existing. And tone of the external anal canal. Tone means that any neurologic diseases associated with it will also give the useful for further management of this condition. After examination, we can advise investigation related to this.
Okay.
In that investigation, urine routine first test. In urine routine to check for any hematuria, all those, and any bacteria infection, and then kidney function test, serum creatinine, and serum PSA.
Okay.
In serum PSA in normal adult, it should be less than 4 nanogram per ml, and if it is more than 4 to 10, it is known as gray zone. to 10, we should further evaluate regarding it is any other inflammatory condition or malignancy chance also. And more than 10, more chance of malignancies. So again, we need further evaluation. If it is less than 4, we will consider as BPH.
Okay, so less than 4 is normal. If the PSA level is less than 4, it's normal. And if it's above 10, that's a red flag. Then that you have to look out for any kind of malignancy.
Malignancy and biopsy of the prostate and scan of the prostate.
Okay,
And even in the 4 to 10 is known as gray zone.
Okay.
It will come this side or that side. If it is comes in gray zone, we should check other tests are there. Free PSA also. Free PSA more than 25% of the total PSA. Then it will come as BPH only. If it is less than 25%, then again I go for malignancy. Like that.
And could you also throw some light on the management of this disease in medical terms? How do you go about it?
Management of the BPH patients again depends on the severity of the LUTS and findings of the ultrasound, PSA levels, prostate size and post-void residual volume, multiple factors. 7 clinical features are considered in IPSS score, International Prostate Symptom Score, and quality of life of the patient. These 7 symptoms like I mentioned frequency, urgency, nocturia, intermittency, incomplete voiding, straining on urination and reduced stream of the urine. All these 7 are internationally accepted. Each symptom is given 0, 1, 2, 3, 4, 5 points. So total will be 35 points. We should give the questionnaire to the patient. He will tick how much he is suffering. Then total points we will tell. We should calculate. Then symptoms are classified as mild, moderate, severe depending on the score. Mild is 1 to 7, 8 to 19 moderate, 20 to 35 severe score. After this score, then we can look for the ultrasound. Prostate size is less than 40 is small size, more than 40 is considered large size, and PSA levels also. If it is more than 2 is considered more, and less than 2 is okay for medical therapy. I will detail later. And after this, management depends on the again classified as watchful waiting, medical management and surgical management.
So could you please elaborate on what exactly is this watchful waiting? Are there any advantages and disadvantages to this one?
This watchful waiting is only useful for small prostate, lesser PSA values, and for mild symptoms. Mild symptoms, that score I mentioned, up to 1 to 7 in that range. And some patients in moderate to severe also not willing to take medicine because of they don't want to suffer the side effects of the medicine. So such patients will keep in watchful waiting. In watchful waiting also, during the course of the management, they will be under supervision, regularly doing these investigations, blood test, ultrasound and serum PSA, digital rectal examination, like that. And if any changes are worsening of the symptom during this course, then they will need medical or surgical treatment. The disadvantage of this is even the who selects watchful waiting, in a span of 5 years, 20%, approximately 1 in 5 will end up worsening of the symptoms and need intervention.
So the patients have to be monitored on a regular basis, even if they are doing watchful waiting, and that period is 5 years.
In 5 years, even then 20% will require treatment.
Requires surgery.
So that is the disadvantage of the watch.
Once a patient has been diagnosed with BPH, then what is the future course of treatment, the medical treatment for this condition?
Okay, medical treatment for the moderate and severe symptoms and larger prostate glands. First line of management. Again, in medical management, many drugs are alpha and blockers, 5-alpha reductase inhibitors. Alpha blockers are tamsulosin, alfuzosin and silodosin. Tamsulosin is 0.4 milligram taken once daily. The effect come 1 to 2 days and maximum effect will be felt in 2 weeks. Persist up to 4 to 5 years, we can choose it. The mechanism of action is alpha-1 blocker antagonist.
Doctor, we need a few more things from you, but before that, we'll take a short break. Viewers, don't go anywhere. We'll be back after a short break very soon. Welcome back to BMC Global Live Al-HILAL Health World. But do these medicines have any severe side effects? Does it have a long-term effect on the health of the patient?
Yeah, this alpha blockers having the side effects. The mechanism first I will tell once again. So
Sure.
the alpha 1 receptor are more present in the bladder, neck and prostate. When this causes antagonist action of the receptor, it will open up the channel for the urine flow. So patient will feel prostate related symptoms, urinary passage early, and it also causes side effect because of the alpha receptor present in the other parts of the body, which cause vasodilation and causes the side effects like headache, giddiness, nasal stuffiness, asthenia, whole body weakness. And other means for sexually active patients is retrograde ejaculation it will cause, and postural hypotension because of vasodilation it will cause the BP lower down. So it should be taken in bedtime when after dinner. They should not move around. So they can fall. Chance of falling is there. So this is the side effect of the alpha blockers. So in alpha blockers also 3 drugs are there. Tamsulosin will cause this more the partial hypertension, whereas silodosin where rapidly acting cardiac patient will give, it will start immediate action 2 hours. Silodosin given 8 milligram once daily, that also after dinner time. It will cause less of cardiac, means BP variation very less, but it may cause maximum retrograde ejaculation. So it is for sexually active patient will not prefer. And for sexually active, one more drug is there, alfuzosin, 10 milligram per day, night after dinner they can take. So less chance of postural hypotension. So and these other side effects are also there. So these alpha blockers interact with other antihypertensives. So if patient is on other antihypertensive, so it will also further reduce the BP. So we should completely watch or take history which medicine is taking. We should not give. And some patient will be erectile dysfunction, they will be taking phosphodiesterase inhibitor, example tadalafil. So that will also further reduce the BP. So if BP we should monitor, and if it's already taking this medicine, we should not give this. That is a side effect. And alpha blockers will also affect on the eyes because of the alpha receptor present in the eyes.
Okay.
If the patient posted for cataract surgery, 2 weeks before we should stop it. Otherwise, intraoperatively during surgery time, it will cause Plafi syndrome. So that is also another important point to be kept in mind for alpha blocker. This is first. But another disadvantage of alpha blocker is it will not reduce the prostate size. Shrinkage will not occur. Only it will give immediate relief. But as the age increases, it will keep on growing prostate and size will become more, and we cannot avoid the further natural history of that. So anytime you may end up in surgery or complication, hematuria, like that symptoms. This is the disadvantage of alpha blocker. Okay. I will go to one more medicine, that 5-alpha reductase inhibitor. Okay. 2 medicines. Whereas 5-alpha reductase, 2 drugs are there, finasteride 5 milligram, dutasteride 0.5 milligram. They are also taken once daily. The mechanism of function of 5-alpha reductase inhibitor. So as I told before, the testosterone converted to dihydrotestosterone with the enzyme alpha reductase. This enzyme is inhibited. So the DHT is not formed. So prostate growth will be inhibited. The advantage of this is it will shrink the prostate and cause the PSA reduction also.
So what about the effect of these medicines on the PSA level? Does it alter the PSA levels in any way?
Alpha blockers will not alter PSA and also prostate size also, whereas these 5-alpha reductase inhibitors will cause the prostate shrinkage. Approximately 20% get shrinked in 6 months, and at the end of 1 year 50% reduction in PSA will come. And another most important advantage is not worsen the symptoms. It will avoid the future surgeries and future hematuria complication, and future acute urinary retention chances will be avoided. But the side effect is, and the disadvantage and side effect. The disadvantage is it will take action begin at 3 months, 3 to 6 months effect will start, and maximum effect will be in 2 years. So up to effect will continue up to 5 years. This is a disadvantage. So for any patient to get immediate relief, we should give combination therapy. Combination means alpha blockers and this 5-alpha reductase. Alpha blocker give immediate effect, but it will not cause any shrinkage of prostate. But this will shrinkage will start for long-term effect. So both the drugs will be given. And this tadalafil 5-alpha reductase inhibitors, finasteride and dutasteride, the side effect is also more because they will inhibit the testosterone conversion to dihydrotestosterone. The side effects are loss of libido, loss of sexual drive, and semen quantity will also be less. Ejaculatory and erectile dysfunction also it will cause. These are all the side effects of the 5-alpha reductase inhibitors. So combination therapy is beneficial, and if we give combination therapy, the side effects of both the drugs will come to the patient. Initially it will be more, but as the time progresses, they will get adjusted to side effects, and side effects will be less once the time advances.
So what are the key factors based on which you decide whether a patient needs to go in for surgery? Because surgery is always a last resort for any patient. So when do you decide that a patient needs surgical intervention?
So actually, surgery after if we give medical management, the chances of surgery in this era is very less. Before, all patients will end up in complications directly surgery. Now because of these medicines, 5-alpha reductase shrinkage will happen. Except very large prostate, having family history, this runs in families but not genetic disease, they will require surgery. Other people will not end up surgery, but some people will develop prostate enlargement even after this treatment, and refractile symptoms are not relieved this medicine, they need surgery. And other absolute indication is only renal incompetence, that is kidney damage because of this prostate. That is absolute indication of surgery. Other relative indications are because of this enlargement, recurrent urinary tract infection and recurrent hematuria, and failed trial wide after once we put the tube and again we remove and try for urine, it is failed. Like that, minimum one failed trial wide, hematuria, and bladder damage because of this prostate, bladder diverticuli will happen, and bladder stone will form because of prostate. In such cases, surgery is the only option. Otherwise, medical cure most of the patients.
So doctor, any general advice or tips that you would like to share with our viewers on how to prevent this from happening, and even if they do get it, then how to go about it, how to handle this?
Actually, after 50 years of age, 50% of the people will be having this condition. Some will be symptomatic, some will not be symptomatic. So better to consult your urologist once to check the prostate related test, serum PSA, ultrasound, and post-void residual, prostate size, kidney function. If the baseline is already more, even if you don't have symptoms, better to take medicine to further worsening of the symptom. That is my.
Thank you, Dr. Sankar. Thank you for that informative session.
Thank you for giving this wonderful opportunity.
Viewers, for any urology related issues, please visit Dr. Sankar N in Al-HILAL Hospital, Manama. I hope you found this session informative and useful. For many more informative sessions like this, don't forget to tune in to BMC Global Live Al-HILAL Health World. Till the time we meet again next, this is Anupama signing off. Goodbye, stay safe, stay healthy and stay happy.